If painful dentures or your teeth prevent you from enjoying one of life's great pleasures, like eating great food, David & Associates offers a solution, a life-changing procedure called Teeth in a Day. Come to David & Associates in the morning for implants and leave with permanent teeth the same day.
Life's too short not to enjoy it. Call David & Associates for a free consultation on a revolutionary procedure that can give you a dazzling smile and change your life.
I would like to go over what a patient receives with the Teeth in the Day program. First, on the day of surgery, the patient receives an interim permanent set of teeth that is carefully fabricated to give the patient excellent aesthetics and function. However, this restoration does not have a custom titanium bar. Our patients will wear this interim restoration around 5 months, and then it will be redone with a custom titanium bar. We use the ISIS titanium restoration, which was made by the same company that made the replacement lens for the Hubble telescope. This computer-assisted and designed bar is the key and foundation to the long-term success of the whole process. First, the bar, which is milled from a solid block of titanium, gives this restoration incredible strength from the forces of chewing that patients will subject this restoration for years to come. I'm actually having patients come to my office with so-called permanent teeth that have no bar in them, that are breaking a short time after they're made, asking me to fix them. What they actually have are temporary interim teeth. We make these for our patients to last until the implants totally fuse to the bone, and then we make them with a titanium bar around 5 months later. Unfortunately, these patients were told their all plastic teeth were permanent. The other main reason we only use custom titanium bars made from a solid block of titanium is because you absolutely need the restoration to screw into the implants with an exact, precise, passive fit. If the bar doesn't do this, it can place forces on the implants when you screw the restoration down that will make the implants fail. Why would someone even use these techniques? Because it costs a fraction of the cost to fabricate a custom titanium bar milled from a solid block of titanium. But think of it. Are you saving anything when someone makes an ill-fitting bar or uses no bar at all, and a short time later the whole restoration breaks or the implants fail? At David & Associates, we only use the exact protocol of how permanent teeth should be made to the most exacting standards that are currently available. We use no shortcuts.
You are witnessing this beautiful young lady transform from wearing an unattractive, ill-fitting denture to a beautiful smile supported by dental implants. Imagine this being you. Our Teeth in a Day program will miraculously give you permanent teeth the same day. At David & Associates, everyone can enjoy a beautiful smile, properly eat food without pain. Call David & Associates and get started with a free consultation and CT scan and enjoy life to the fullest. Call David & Associates and get started today.
Today, let's go over several cases. The first patient we'd like to meet is John. And John, I'm very pleased that you're here, and I'd like to have you go over just basically, how you presented to my office with a full denture, the problems you were having with it, and then let's just go over the actual day that you had your teeth placed.
Sure. First, let me thank you for inviting me here. I'm pleased to have the opportunity to talk about my experience. As you know, Dr. David, I've been a patient of yours for 10 years or so, and I've always been extremely anxious about dental procedures, everything from simple cleanings to periodontal work. So when I made the decision to move from a denture to the implants, I knew that it was going to be a difficult decision for me based on how anxious I am about the process. But having had the upper removable denture for a year, I knew that it was something that I would not be able to use long term. With the placement of that removable denture, I immediately saw a difference in my sense of taste. I saw that my speech was different. Just a lot of challenges in trying to get used to that. So when the opportunity came up to talk to you about permanent implants, I was truly excited, but at the same time very anxious. So we moved ahead with the procedure, and on that day, just to recap my experience, came into your office in the morning, immediately felt very comfortable thanks to yourself and the great team you have in place there. Immediately comfortable, and Fortunately, there's little that I remember between the time we started the procedure and the time that I left later on in the day, and I say fortunately because it was quite extensive, the work that needed to be done. But the experience, having left your office later on that afternoon and being aware of how I felt, I was very, very surprised by how easily the entire procedure went.
Tell our audience, if you would, basically the level of the discomfort you had the next day, what kind of pain pills you had to take.
I'm always reluctant to take any medication unless I truly need it. But the next morning when I woke up, other than some very general soreness, and I say soreness, not pain, I was very comfortable. And I took 2 ibuprofen early in the morning and seemed to relieve that soreness, and didn't need anything after that.
We did minimally invasive surgery in your case, and part of the show is to show our audience how we do minimally invasive surgery with an in-house 3D CAT scan machine, where we actually take a 3-dimensional scan, which we did in your case, and then we actually go, and it's a computer program where we, in virtual reality, do your surgery before we really do the surgery. And this enables us to make a surgical stent that, when we use the surgical stent, we don't have to do flaps and we don't have to place sutures. And what's exciting on John's case, we were able to place 6 implants in approximately 37 minutes. The other surgery you're going to see was the same number of implants were placed, and it was about a 2.5-hour surgery. So I'd like to, Dr. Forst, to go over what was the planning entailed, how did you use the computer program to make that template, and what does it mean to you to be able to do a surgery with minimally invasive, the minimally invasive template, versus where I've seen you place thousands of implants before we had the technology to do minimally invasive surgery.
The key word I would say is planning, and just making sure that ahead of time that all of the work and the precision of where you want the implants to be in reference to the height of the implants, left or right, side to side. With a 3D CT scan, you can 3-dimensionally plan the case ahead of time. And after you do basically like a virtual reality surgery on a computer, you can have a special template or guide designed for precision placement of where you want the implants to be. Without having to do incisions or flaps or sutures, these things that would cause healing to be delayed and to have more swelling and more discomfort, we're now able to minimize it with minimally invasive surgery, so that the case can be done in a quicker amount of time with less discomfort and quicker healing.
Most of the discomfort comes from laying the flap, of actually peeling the tissue away from the bone. There's very few nerve endings in the bone. So by doing the surgical template and not having to lay a flap, it's like a little wood screw going in a wall. If you've ever placed a wood screw, you take an electric drill and it just drills right into the bone. And that's what you're seeing on John's case. So we basically just had 6 small implants that were able, within seconds literally, to drill the implant in. And then what you're going to see, the technique, what I did is I came in and we pre-made John's restoration, and then what you're seeing is we take an impression over the implants, and then my laboratory technician takes about 2 hours to fabricate the parts to that restoration that allows us to anchor that restoration to the implants, and that's why we can do this restoration in 1 day. If I had to ask you, if you had a close family member or a friend and they were having denture problems, now that you're 6 weeks out, how would you recommend this procedure versus, you knew what it felt like to wear a full denture for a year?
Oh, I would recommend it wholeheartedly. The difference is significant. A couple of weeks ago I was out to dinner with my wife, and we were sitting having a meal, and it just occurred to me as I was enjoying my meal that this restoration feels more like my original teeth, but I've got to say better. Better because I'm chewing properly, it's aligned properly, and the kinds of things that I wasn't able to achieve with the removable denture, but most significantly was the sense of taste. I immediately realized when I had that upper denture placed, and I consider myself somewhat of a foodie. I enjoy fine dining and good food, being of Italian heritage, and I missed many of the flavors and the nuances of some dishes.
You know, I know we delayed this surgery because you were going to Italy and you were going to Milan.
That's correct.
And you wanted to eat
Yes.
veal chops, and
Yes.
so you were worried about that if we
That's
did the
correct.
surgery
That's
before,
correct.
you weren't going to be able to eat your veal chop. But in
That's
reality, you were telling me within a week. Actually, let me ask you this: you had no problem going back to work within a few days, did you?
No, I did not. In fact, if I recall, the procedure was done on a Tuesday, and on Thursday I was back in the office at work, and on that particular day I had my usual 7 hours of conference calls. No difficulty speaking, no challenges in terms of going out to lunch and enjoying a lunch.
Yes.
So yeah, I was back at work within the 2-day period.
You know, your concerns about actually doing this in one day, I think you found out we really can do it in one day.
Mm-hmm.
And then your other main concern about the level of discomfort, if you're talking to people, they don't really have to worry about the discomfort, especially when we're doing this with minimally invasive surgery.
Sure. And you know, when I heard that this could be done in one day, I was somewhat skeptical.
Yes, I know.
How could all of this very detailed, very involved work be done in less than a day? Essentially, as you said,
Yes.
it took 37 minutes, and
Yes.
I believe I was in your office for perhaps 4 or 5 hours that day. So I was skeptical there, but it is so important that I'm able to enjoy, once again, all of the things that I was able to do prior to getting that removable denture placed.
Well, thank you very much. All right, appreciate it very much. Thanks. I would like to go over what a patient receives with the Teeth in the Day program. First, on the day of surgery, the patient receives an interim permanent set of teeth that is carefully fabricated to give the patient excellent aesthetics and function. However, this restoration does not have a custom titanium bar. Our patients will wear this interim restoration around 5 months, and then it will be redone with a custom titanium bar. We use the ISIS titanium restoration, which was made by the same company that made the replacement lens for the Hubble telescope. This computer-assisted and designed bar is the key and foundation to the long-term success of the whole process. First, the bar, which is milled from a solid block of titanium, gives this restoration incredible strength from the forces of chewing that patients will subject this restoration for years to come. I'm actually having patients come to my office with so-called permanent teeth that have no bar in them, that are breaking a short time after they're made, asking me to fix them. What they actually have are temporary interim teeth. We make these for our patients to last until the implants totally fuse to the bone, and then we make them with a titanium bar around 5 months later. Unfortunately, these patients were told their all plastic teeth were permanent. The other main reason we only use custom titanium bars made from a solid block of titanium is because you absolutely need the restoration to screw into the implants with an exact, precise, passive fit. If the bar doesn't do this, it can place forces on the implants when you screw the restoration down that will make the implants fail. Why would someone even use these techniques? Because it costs a fraction of the cost to fabricate a custom titanium bar milled from a solid block of titanium. But think of it. Are you saving anything when someone makes an ill-fitting bar or uses no bar at all, and a short time later the whole restoration breaks or the implants fail? At David & Associates, we only use the exact protocol of how permanent teeth should be made to the most exacting standards that are currently available. We use no shortcuts.
If painful dentures or your teeth prevent you from enjoying one of life's great pleasures, like eating great food, David & Associates offers a solution, a life-changing procedure called Teeth in a Day. Come to David & Associates in the morning for implants and leave with permanent teeth the same day.
Life's too short not to enjoy it. Call David & Associates for a free consultation on a revolutionary procedure that can give you a dazzling smile and change your life.
Call us today for a free consultation. You know, it only takes around an hour to plan a whole new smile just for you. You'll meet our team of specialists to decide on a custom treatment plan that is designed just for your situation. First, you'll receive a free 3D CAT scan to know the condition you're in and to see the quality of your bone, existing teeth, nerves, and tissue. We want to make sure that when we place your implants, they're there for years to come. Our team of specialists will help you decide on the best treatment for you. You will know clearly how we will design your teeth to last and give you a beautiful smile. You will also leave with a clear cost estimate. Lastly, we understand dental implants are an investment, and our financial coordinator will help you come up with an affordable payment plan that you know is comfortable for you. You know, I'd like to introduce you to another patient of David & Associates, Debbie, and I'd also like to introduce you to Dr. Vladimir Jovic, who is a certified prosthodontist, which is a crown and bridge or implant specialist. So, Debbie, if you talk about, how you presented to our office and why you presented to our office, and then again, Dr. Jovic is the person that surgically placed your implants and restored your case. I'd like to go over a little bit, what we accomplished for you.
I came in because I did have multiple teeth that were failing. Some were from way back a car accident many years ago, and then just had kind of lost all the support from the surrounding teeth because of it. I have a kind of a high profile job, so I wanted to be sure that I was not missing teeth for some period of time before I got the full replacement teeth. And so we did it on a Friday afternoon, which was good because I had the weekend to really have some recovery. I was pleasantly surprised, had very minimal pain Friday night.
Right.
Mostly probably just from having my mouth open long enough to do the procedure.
It was open a while.
Because I really did not have, I had no bruising, no real soreness, no real pain, and never had to take a pain pill after the first night.
That's great.
Yeah.
Let me ask you, when were you able to go back to work?
I went back to work Monday.
Monday. Did I tell you to do that?
I came in and you said, well, did you go back to work? I said, yeah. I don't miss many days, so he kind of knew. I worked from home the first day, and but I was back,
You know what's nice about your case, just if you'd came in a few years ago, the traditional way we would have done this case is we would have pre-made a temporary denture. We would have taken the teeth out, placed the implants, and then we typically waited with the older systems of implants 6 to 7 months that you had to wear a temporary denture. So when we have a patient like you in a high-profile job, then you have all the disadvantages of wearing a denture that's moving. So in this case, even if we have many broken or failing teeth, that was what's exciting, is that Dr. Jovic was able to take your teeth out, place the implants, and then you were able to go out with permanent teeth, and then you were literally, able to go back to your job 3 days later,
Right.
and then, be in a high-profile job.
And within a week, I was eating soft food maybe a week, and then I was able to progress very quickly.
How would you say,
nice.
are you pleased with the case?
Very pleased. Easy to eat with. My smile is very good. Noticeably different, but nobody really notices what it is, which is very odd. Big perk was losing some of the wrinkles around my mouth just because my teeth were so small. This kind of filled in some area.
What were you telling me earlier about the age
Oh yeah,
difference?
people that don't know me.
Yeah.
The girl that was doing my makeup today, I've asked several people, how old do you think I am? And most of them guess about 10 years younger.
That's great.
So it's been very nice for that.
When I'm looking at it, it's because your facial profile looks so good. With
Right.
your restoration, it's really giving you really nice lip support. Is that what
Right,
you've really
and
noticed?
You should tell him how much you worked on that. He really worked on giving me a better profile because that was very important to me.
We did a couple try-ins because we had some missing teeth in there, so we were able to do a couple try-ins. And one of the major things that when she came in aesthetically were the inability to show your teeth when you smiled. And we wanted to really add the teeth, even in this stage, even though this is the temporary teeth,
Right.
we wanted to go ahead and give you a smile. The other thing we worked out was the lip support.
Right.
To really bring that out. And even though this is the temporary phase, I think we did a great job. And this is a nice template for our final restorations. We can really take from this temporary stage what we're going to do for the finals.
Right, and it made a very big difference because my teeth were so small. They were like little chiclets. And so even when I smiled, I had no lip support, so I almost had no top lip, and he really worked with me and got it to where I had a much better profile. Actually made my face look thinner while filling it out still, so it was very good.
Now, if you could tell our audience, when you basically came in for your procedure that day, with the sedation and the anesthesia, what was your discomfort level, or what do you remember of the procedure?
Well, that's very interesting because I'm a nurse, so I'm very big on sedation. I think moderate sedation is, you know, the 8th wonder of the world. So I actually talked with them about that. I really wanted moderate sedation and really
Right.
wanted anesthesia. And they talked with me about it at great length, and I felt very comfortable just doing the sedation that we did. I don't remember anything of the process until he started putting the teeth in and asking me, you know, how does it look? Where do you want me to work on it? And looking in the mirror. That's really the only recollection I have. I had a
Perfect
very,
time to start remembering.
yeah, had a very pleasant experience. No discomfort during the procedure whatsoever.
You know, that's what the big change in this procedure is that basically this is an improved version of what we call an all-on-4 hybrid bridge, which is supported by implants. And my practice has been doing this restoration for over 20 years. My mother has this restoration that we did in 1991. But again, we would place the implants, wait a number of months, then come back and do the restoration. And so you were stuck with wearing the temporary denture and the disadvantages of having a moving denture, especially when you're in a high-profile job. So it was just unfortunate you had to wear that. So now, because of the planning we can do, and for most of our patients, we can go immediately with the new generation of implants to permanent teeth in one day. You can, you know, basically recover for a couple days, and you can see basically within a few days you can go back to work. And that's what I think is really exciting about this procedure from doing it over 20 years.
Right, and being able to see that, you know, your looks are so improved.
Yes, and you know what's
just a
amazing,
day.
again, this technique, really what you're getting is we're pre-making a restoration that's permanent, that's done in one day. But then after we let the bone totally fuse to the implants, and then after you get used to this, we come back, and what makes this restoration like my mother's last for decades is we do a custom titanium framework, and we redo this in 5 months after everything is totally healed. So you give us another opportunity to really refine the aesthetics and the cosmetics of the case to make sure that you're perfectly pleased with how this looks, so that when you go out in public, you're exactly pleased with, you know, what we're accomplishing for you. Again, if you had, you know, a friend or, you know, close family member, would you recommend this procedure as far as discomfort level and, you know, of what it's accomplished, and did it accomplish what you thought it was going to accomplish?
Absolutely. I actually have several friends that are looking into it, and cost has been one of the things, and I explained to them, you know, I drive a Mercedes because I want to, and it costs more.
Yes.
And this is every day. This is my face.
Yep.
Yes.
This is what I look like every day. Completely satisfied.
Well, thank you.
There's nothing in your life you could buy that would make you feel better about yourself if you have teeth that are not good.
You know, it's funny you said that, because, you know, I have patients come in, and it is a significant investment, you know, but people will go buy a mid-price boat, or they'll, you know, buy a used car literally, and in 3 or 4 years it's not worth anything. Or they'll actually, how many patients, it'll funny, they'll come in and they'll buy a Mercedes and they'll say, well, you know, I don't know if I want to go and get rid of my denture to go to permanent teeth. But
Right.
if you invest in permanent teeth, if you don't like the problems of a denture, you're going to have something that's going to last you for decades, where even if with a Mercedes in 4 or 5 years, it's not
Right.
worth too much.
Right.
You know,
And it's your appearance every day. It makes a very big difference.
did it make a difference in your, you know, confidence going out
Oh,
when you're?
certainly. I make webinars and do different things in my line of work, and so I feel a lot less self-conscious talking in front of a lot of people. I meet a lot of new people in the hospital industry that I'm in, so much more confident in the way I talk. You can probably remember I kept my mouth
yeah.
very closed, and my former video, people will be able to see it's a big difference.
You know, I
for
think,
me.
you know, being a nurse is, you know, what a lot of people don't realize is when you're wearing full dentures, you can't eat the proper foods for proper health. So, you know, some of
Right.
the things you're supposed to actually eat, you can't eat with the denture. And is that what you're finding out, you know, about a month later, you're starting to really eat what you want to eat?
Oh yeah, I've been having steak even.
Great.
So, big difference.
Big
Very
difference.
big difference in how I eat, and being able to chew and things like
It's
that.
life-changing.
Very life changing. Yes.
So you're pleased with the procedure? You'd recommend it?
Extremely pleased. Would highly recommend it.
Oh, excellent. Well, then I'd like to thank you for being on our show today.
Thank you.
And thank you very much. You know, you might be watching this show and thinking the Teeth in a Day procedure could really solve my problems, but I hate to go to the dentist and it must really hurt. First, on the day we insert your implants, you'll be completely sedated. Most patients don't remember the procedure being done. In many cases, the procedure can be done, as you've seen on this show, with minimally invasive surgery. You're going to have no flaps cut, no sutures, dramatically less swelling and discomfort. You know, you've probably heard the saying that you have nothing to fear but fear itself. It's true. Call us today for a free consultation or a second opinion.
You are witnessing this beautiful young lady transform from wearing an unattractive, ill-fitting denture to a beautiful smile supported by dental implants. Imagine this being you. Our Teeth in a Day program will miraculously give you permanent teeth the same day. At David & Associates, everyone can enjoy a beautiful smile, properly eat food without pain. Call David & Associates and get started with a free consultation and CT scan and enjoy life to the fullest. Call David & Associates and get started today.
I would like to go over what a patient receives with the Teeth in the Day program. First, on the day of surgery, the patient receives an interim permanent set of teeth that is carefully fabricated to give the patient excellent aesthetics and function. However, this restoration does not have a custom titanium bar. Our patients will wear this interim restoration around 5 months, and then it will be redone with a custom titanium bar. We use the ISIS titanium restoration, which was made by the same company that made the replacement lens for the Hubble telescope. This computer-assisted and designed bar is the key and foundation to the long-term success of the whole process. First, the bar, which is milled from a solid block of titanium, gives this restoration incredible strength from the forces of chewing that patients will subject this restoration for years to come. I'm actually having patients come to my office with so-called permanent teeth that have no bar in them, that are breaking a short time after they're made, asking me to fix them. What they actually have are temporary interim teeth. We make these for our patients to last until the implants totally fuse to the bone, and then we make them with a titanium bar around 5 months later. Unfortunately, these patients were told their all plastic teeth were permanent. The other main reason we only use custom titanium bars made from a solid block of titanium is because you absolutely need the restoration to screw into the implants with an exact, precise, passive fit. If the bar doesn't do this, it can place forces on the implants when you screw the restoration down that will make the implants fail. Why would someone even use these techniques? Because it costs a fraction of the cost to fabricate a custom titanium bar milled from a solid block of titanium. But think of it. Are you saving anything when someone makes an ill-fitting bar or uses no bar at all, and a short time later the whole restoration breaks or the implants fail? At David & Associates, we only use the exact protocol of how permanent teeth should be made to the most exacting standards that are currently available. We use no shortcuts.
If painful dentures or your teeth prevent you from enjoying one of life's great pleasures, like eating great food, David & Associates offers a solution, a life-changing procedure called Teeth in a Day. Come to David & Associates in the morning for implants and leave with permanent teeth the same day.
Life's too short not to enjoy it. Call David & Associates for a free consultation on a revolutionary procedure that can give you a dazzling smile and change your life.
Teeth in a Day can give you back a beautiful smile, but more importantly, let you eat foods you may not have been able to eat for years. No more trouble eating carrots, apples, or corn on the cob. When you go out in public or on a date, no more embarrassment about how you look or bad breath because of failing teeth. What better investment or return on investment than investing in your own oral health? You know, if you have serious denture problems or many failing teeth, your suffering can be over. Call my office for a free consultation to see how we can help you. If you're watching this show, you most likely need help. Don't procrastinate. Call us today for a free consultation or a second opinion.